Hematopoietic progenitor and stem cells. Hematopoietic progenitor and stem cells play a vital role in modern medicine, particularly in the treatment of patients whose bone marrow has been compromised. These cells are used to regenerate bone marrow following chemotherapy or radiation therapy. They are also employed to replace defective marrow cells in individuals with congenital immune deficiencies, various forms of anemia, and malignant disorders affecting the bone marrow or red blood cells. Sources of stem cells. These life-saving cells can be collected from 3 primary sources: bone marrow, umbilical cord blood, peripheral blood, through a process known as apheresis, allogeneic marrow transplants. In cases where the stem cells come from a donor, known as allogeneic transplantation, matching the human leukocyte antigen, HLA, between donor and recipient is crucial. An exact HLA match significantly reduces the risk of graft-versus-host disease, a serious complication where the donor cells attack the recipient's tissues. Interestingly, compatibility of blood type ABO is not required for a successful transplant.